नमामि धन्वन्तरिमादिदेवं सुरासुरैर्वन्दितपादपद्मं लोके जरामृत्युनाशं दातारमीशं विविधौषधीनां शङ्खं चक्रं जलौकां दधतं मृतघटं चारुतोर्भिश्चतुर्भिः सूक्ष्मस्वच्छादिरुद्यं शुकपरिविलसन् मौलिमं भोजनेत्रम् कालाम्बोदोज्ज्वलाङ्गं कटितटविलसत् चारुपीताम्बराढ्यं वन्दे धन्वन्तरिं निखिलगदमिव प्रौढदावाग्निनीलम्।
शङ्खं चक्रं जलौकां दधतमृतं घटं चारुदौर्भिश्चतुर्भिः सूक्ष्मं स्वच्छातिरुद्यं शुकपरिविलसनं मौलिमम्बोजनेत्रं कालाम्बोद्योज्ज्वलाङ्गं कटितटविलसश्च चारुपीताम्बराढ्यं वन्दे धन्वन्तरिं तव निखिलगदमिव प्रौढदावाग्निलीलम् प्रौढदावाग्निलीलम्।
Avasji, for this session, I am making the host to you. So I hope that the session will be moderated by NAMSS Nepal.
Okay, sir. Okay, sir. Okay. Good afternoon, everyone. We will start our sessions within 5 minutes. Please wait for a few minutes.
Namaskaram, everyone. Am I audible?
Yes, Dr. Pratima, you are audible.
NAM Central, am I audible?
Yes, Pratima, you are audible.
Thank you so much. Namaskaram, everyone. Welcome to Dr. Rishiram Koirala Memorial Webinar Series organized by Nepal Ayurveda Medical Student Society, NAMS Nepal, with the collaboration of ADF Ayush Darpan Foundation India, Vivida Private Limited Sri Lanka, and Felix Zen Bangladesh. I am Dr. Pratima, Executive Member of NAMS. This is the 4th webinar series on Dr. R.R. Koirala Memorial Webinar. And for today, we have two honorable speakers from India. Dr. Satya and Dornala will be speaking on the topic Art and Science of Arthritis Management and Integrative Perspective. And Dr. Raman Koirala sir will be expressing his word of thanks on the webinar today. Without delaying anymore, I'd like to move forward with the program. And for that, I'd like to welcome our speakers, Dr. Satya and Dornala, Panchakarma specialist, Swami Vivekananda Ayurvedic Panchakarma Hospital, and Dr. Raman Koirala, sir, consultant neuropsychiatrist in this online event. Similarly, we'll like to express our hearty welcome to all the dear participants joining us today. Now, moving on to the topic, I'd like to hand over this platform to Dr. specialist. So he had done his BMS, MD, MS, and PhD. Diploma in Hospital and Healthcare Management, OU. Sir, please. Sir, the platform is yours now. Are you available there?
Yeah, I'm there.
Sure, sir, sure.
Yeah, thank you. Hope I'm audible.
Yes, sir, you are.
Thank you, doctor. And thank you, first of all, at the outset, let me thank the organizers, National Ayurveda Medical Student Society, Nepal, for making this part of this program. Yeah, I'm sharing my screen. So, doctor, please enable, you have disabled the participant screen sharing. Yeah, Dr. Pratima.
Yes, sir, you are audible.
Yeah, fine.
Yes,
you
sir.
made me as a host now. Screen is also visible now.
Yes, sir, it is.
Yeah, doctor, what is the time given to me?
Sir, it's about around 30 minutes, sir, around 30 minutes.
Yeah, 30 minutes.
Okay, sir.
Yeah, okay. Thank you. So welcome you all for this wonderful program, this memorial series lecture. And moving to my topic, art and science of arthritis management and integrative perspective. Hope you all must have heard the arthritis, and the moment the word, if you listen to the arthritis, the irritating aspect of arthritis is the pain. Pain is the major one, which actually the patient being affected with because of arthritis. And in the first slide, if you could see, and this particular pain management is not the challenge only in these days. Even this is a major challenge even during those good olden days. Even if look at the prayer of Dhanvantari, Namami Dhanvantari Madidevam Surasurair Vandita Pada Padmam Loke Jara Rugbaya Rutyunasham. By this prayer, we can understand that it's not only that we're praying the God. We are seeking the blessing of the God to conquer the major three conditions. Those are the major health challenges during those days. That is, second line goes, Namami Dhanvantari Madidevam Surasurair Vandita Padapadnam. Second line goes, Loke Jara. Jara means old age. Rugbaya, that is pain, dreaded pain. And third one is Mrutyunasham. So these three major conditions are the major health challenges during the olden days. And among these three, that is old age, pain, and third one is the death. And among these three, pain management is a major challenge during those days. And even till today also, the pain management is a major challenge. And particularly with respect to arthritis. The reason I try to take the aspect from the integrative perspective, and it mainly includes less theoretical, more of practical in nature. Yeah, moving further, as you all know, today is 2nd October. It is being celebrated as an International Day of Non-Violence, remembering the birth anniversary of Mahatma Gandhi, father of the India. So when I got this, an idea came, a quote by Mahatma Gandhi came to my mind. This quote goes like this, which is indirectly reflects the aspect of the integration. The quote, which is said by Mahatma Gandhi in 1921, that is, I do not want my house to be walled in on sides and my windows to be stuffed. I want the cultures of all the lands to be blown out about my house as freely as possible. It may be implied that our mind should be open and uninhibited. It should be open to new ideas and new thinking. There should be no artificial boundaries and walls or borders between different domains of knowledge as well as the practitioners of these knowledge systems. So that is the basis of the integration of the different knowledges, particularly medical and medical knowledges. So if such is the case, that is ancient science of Ayurveda and contemporary healthcare stream can gain from each other for far-reaching benefits and newer directions of healthcare in the interest of the patient and the public and the nation and the world at large. Moving further, copyright and disclaimer, and whatever the topics and the contents which are there in this particular presentation, you are free to copy it, adapt it, and use it. There are the few newer terminology and the newer acronyms you will come across, but don't forget, as a matter of ethical practice, don't forget to acknowledge the source. And this particular this presentation is being shared on live on Facebook. So anybody maybe is a medical person, even non-medical person is also the chance of watching this video, and there isn't a chance of self-medication. This disclaimer is important in that perspective, that recipes are the medicines prescribed in this lecture to be used strictly under the prescription of registered Ayurvedic medical practitioners only. Coming to the introduction. The first word which I mentioned is longer lives. What is mean by it? What is mean by it? Look at this second slide. The global life expectancy as on date is increased when compared to the previous decades. Even in Nepal also, the life expectancy as on date is 70 plus years. Even in India is also 71, 73 years. So many countries in the world have achieved a major addition to the life expectancy. But maybe these couple of years due to COVID, the life expectancy has fallen down to a little bit. But otherwise, as a comparatively maybe almost at 10 to almost 2-3 decades back, so every country has achieved a lot in the life expectancy. So in this achievement, that's all the countries could successfully in adding years to life, but forgot to achieve life to years. What makes the difference between years to life and life to years? Years to life, a person is living almost 70 years, 80 years, 90 years. That's what the life span. But life to years means, though the person is living 80 years, 90 years, but is being diagnosed with a different disease at the age of 30 and 35 years. So he is living the remaining 50 years of life almost with an illness. So making that life without disease-free life, so that's what the life, it's truly called as a life. So, but forgot to achieve life to years in terms of lifestyle disease and chronic non-communicable disease. And many more, for example, with respect to this lecture, ABCD, I call it an ABCD. A means arthritis, B means blood pressure, C means cancer, and D means diabetes, many more. And particularly this clinical condition, arthritis, is definitely chronic. non-communicable disease. And particularly in arthritis, persistent pain is a major public health problem today. Almost 1/3 of world's population suffers from persistent recurrent pain. And every individual in his lifetime experience a kind of pain. And the right to pain control is a fundamental right of every patient. So in particularly in acute pain and severe pain. So then we need an aid of addition of modern medicine is also needed. We can't make the patient to suffer with the pain, as it is the fundamental right of every patient. So before going to the depth of that arthritis and exactly what are the pain in the arthritis, it is essential to understand what is the science of pain. The pain means it is an unpleasant sensory and emotional experience associated with actual and potential tissue damage described in terms of such damage. This absolutely simulates with our dukkha in Ayurveda. And how beautifully pleasant and unpleasant. Pleasant is sukha and unpleasant is dukkha. That's what the pain. And nociception is a physiological process underlying the sensation of pain. And there are different terminology which are used to describe this particular pain is the shula, ruk, dukkha, abada, vikhara, ruja, and pida. And this is what exactly the physiology of the pain, how if you look at this if any noxious stimulus is generated on the skin or any part of the body, and this noxious stimulus is being perceived by the receptors present in that particular location, and the stimulus perceived by the receptors being transmitted as a signal, and this particular signal is this conversion of the stimulus to signal is called as transduction. These four processes that make nociception: transduction, transmission, modulation, and perception. And this transaction is the signal transduction is further transmitted to the primary afferent nociceptor, to the spinal cord. And where in the spinal cord, in the spinothalamic tract, this particular is being modulated, either may be exaggerated and minimized more. So that will be further transferred to the central nervous system, to the thalamus, with thalamocortical projections. That is, ultimately you perceive the pain. So these are the transduction, transmission, modulation, and perception. These are the four steps in the perception of the pain. So while it is very essential to understand the physiology of pain, we can target at any level. Maybe you can target at the 4 levels, particularly in the chronic cases. So that is essential to understand the physiology of the nociception. And the Ayurvedic biology of pain, how Ayurveda perceives the pain. The factors involved as usual, that is definitely the Tridosha and the Dhatus and the integrity of the Srotamsi, organ or the course or the site involved, and the mental state of the victim Sattva, and the Kala, environmental factors, and integrity of Bala and Ojas. So there are different factors that are involved in the pain. You may call it as Sampraptikat. And as we all know, without the involvement of the Vata, there will be no pain. So where there is a pain, definitely by default there is an involvement of Vata. And pain due to if Vata, only the Vata is the major, that is radiating, migrating, shifting, shooting, pulsating, fluctuating, wave comes and goes. That is Vishamatva. The pain due to excess Pitta obstructing Vata. As I said, Vata is the compulsory in every pain. As this aggravated Pitta obstructs the movement of Vata, that causes burning, sucking, pulling, cutting, penetrating, flushes, intense, and violent. Pain due to aggressive, that is excess Kapha obstructing Vata, heavy, deep, aching, throbbing, and mild. And maybe if it is because of obstruction, because of Hama, that is heavy and dull. That's how it clears the direction to the involvement of those. This particular Socrates is an acronym which is essential. If any clientele comes to you as you are looking, sitting at looking at a patient and sitting in an OPD, the patient complaining of any pain at any site. So this, you remember this acronym Socrates. So the moment a patient complains the pain, ask specifically what is the site of the pain, localized or diffuse, referred and repeating, and the onset, since how long you are being suffering, and as it is on the whole day or at a specific time, and the character of the pain, that is dull, sharp, throbbing and constant, or the radiating. For example, somebody says I'm having a low back pain, whether that pain is being radiating to your lower limbs or the upper limbs, whatever. So that has to be evaluated. And any association, that means any other symptoms. If the patient is complaining of the pain with burning sensation, pain, even during the pain, he must be having some other any associated symptoms. And the timing and duration. So patient seems every half an hour, every 1 hour, maybe in the mornings, maybe in the evenings, and ask particular duration, the spell of that particular, exacerbation period. And E means exacerbating and alleviating factors, maybe cold, heat, maybe usually patient complains whenever there is a raining. So those kind of things too has to be evaluated, and ultimately, yes, severity. So you may ask on the visual analog scale and 1 to 10, maybe severity 1 to 10. So this has to be, it is a guiding factor to assess the exact opinion, and which is also useful. As per Ayurveda, though in the modern science, for every pain, more or less they have an analytics in the common medicine. But when it comes to Ayurveda, usually, though we prescribe Guglu, but we have a Roga Dishana specific Guglu, we have different kinds of Guglu, which is maybe having a specific action in maybe in the lower abdomen, upper abdomen, and the peripheral limbs, lower body and upper body. There are different things. So that's how, as a physician, it is essential to rule out the Socrates. So coming to the title, which is, primarily the arthritis, and the CDC says that arthritis is the term that includes a group of disorders more than 100, and that affect your joints, not only the joints and the muscles. It includes the joint pain, inflammation, limited movement of joints. When a joint is inflamed, it may be swollen, tender, warm, or to touch or right. And CDC projects that arthritis will increase as a population grows and ages. So almost they project up to 2040, there will be 78 million people in the world. And these are the 5 serious types of arthritis. Among the major severe one is osteoarthritis. Second one is these days it is getting the major one as a fibromyalgia, 5 million, 3 million, gout, and the 1.1 rheumatoid arthritis, lupus is 3,20,000. So that's how these are the 5 serious types of arthritis. And the categorization of arthritis, if you look at that, broad categorization is inflammatory and non-inflammatory. You must be knowing all this. In the inflammatory, there are seropositive, seronegative, infectious, and critically induced. In non-inflammatory, usually degenerative joint disease, particularly osteoarthritis. Seropositive may be rheumatoid arthritis, lupus, scleroderma, and seronegative ankylosing, psoriatic, reactive, and inflammatory disease. Infectious and crystalline is gouty arthritis. That's how these are the broad categorization. And clinically, it is very essential to know whether it is inflammatory in nature, non-inflammatory, or the differential diagnosis of the pain. Yes, particularly in the morning, in the inflammatory condition, pain is more in the mornings, and non-inflammatory in the evenings. And the swelling is soft tissue, and non-inflammatory in the bone. You see erythema sometimes may be absent, warmthness sometimes not absent. So these are the different comparison how to evaluate which is inflammatory and non-inflammatory arthritis. Yeah, as I said, the major one is among arthritis, osteoarthritis. It affects any joint in the body, but primarily, majorly, it is knee joints are being affected majorly with this osteoarthritis. So it is also known as a degenerative joint disease, and almost globally there are 100 million people world suffer from OA, and it's the 8th leading cause of disability, and it is a leading cause of chronic disability between 4th and 5th decade in many people. And my clinical experience I want to share with you all. Usually a clientele came to your OPD chamber, is sitting in a chair and is revealing that I'm feeling the pain in the both the knee joints. And maybe at times the physician will touch the joints and may not. And considering his symptomatology, and maybe you'll rule out the Socrates and you'll prescribe some. But I sincerely suggest you all young doctors and the practitioners that though it is an osteoarthritis knee joints, you don't forget to examine the joints in the standing posture. Sorry, in the standing posture and the lying posture. Why? Because so if you look at this, so then the middle one is the normal alignment and the left one is the knock knees. Usually we see in the obese children, not only obese, non-obese children also we see, and whosoever have the knock knees in the childhood, and that will remain for the remaining part of it, if it is not attached properly. And bow legs usually we see in the aged, particularly mostly we see in all the aged people who have an osteoarthritis. So these has to be examined in the standing posture. So in both the cases, we are complaining of the joint pains. So that is very important. In addition to that, this also another one is there is a chance in maybe in one case in 1,000 clientele. So there is a chance of length discrepancy. So I could come across in my entire maybe 3 or 4 cases in leg length discrepancy. If there is a chance, then so due to uneven balance of the body, then there is a chance of osteoarthritis. So such is a case, we can make the clientele to understand what exactly the condition. That is very important. So or else he is repeatedly coming for months together and he could not get relieved of that condition completely. Then it will be a negative remark on the physician. So it is essential to evaluate the proper. So the second one these days is cervical spondylosis and the lumbar spondylosis, the major one. We could see maybe I can say it's 1 in 6 patients, maybe even I can say 1 in 4 patients. Either maybe the individual from cervical or the lumbar. And one more thing I want to share with you. Anybody either maybe his spondylosis starts with neck or maybe start with the lumbar region. If he is chronic period is suffering from the same problem, maybe in the duration of 5 to 10 years. So other end of the vertebral column is also gets affected. For example, a patient started complaining of neck pain for maybe initially, and maybe after maybe 5 or 10 years, so down the line, he will get the pain in the lumbar region also. Vice versa, even if he starts from the pain in the lumbar region, then again after maybe down the line, maybe for 10 years, so you'll get the pain in the cervical region. The reason is as the individual is being suffering from the pain in particular vertebral column. So knowingly, unknowingly, his walking style and sitting and other alignments will be changed, and the load will come on the other end of the vertebral column. Naturally, that is also gets affected. So that leads to either cervical and lumbar spondylosis. Another condition is also the ankylosing spondylosis. So the word ankylosing spondylosis means vertebrae. Losis means the condition associated with vertebrae. Ankylosing means remember. Ankylosing means remember. If anything, osteoarthritis which is being associated with a fusion of the joints. Ankylosing means fusion. So particularly we see the ankylosing spondylosis where is the fused costovertebral joints and vertebral articulations. So once all this being fused, then it leads to this kind of posture. So that's called ankylosing spondylosis. In simpler terms, we can say rheumatoid arthritis as an rheumatoid arthritis of the vertebral column. And moving it's rheumatoid arthritis, you all know, this is a major autoimmune disease. It affects both the joints symmetrically, and both the sides may be smaller joints and hands, elbows, shoulders, knees, and ankles. So this is how the image is being shown. And we Ayurveda fraternity, we tend to compare rheumatoid arthritis with that is Amavata. So the reason even ankylosing spondylosis also, if you look at the true Amavata clinical symptomatology of Madhava Nidhana, it mostly simulates with the ankylosing spondylosis. But when compared to the ankylosing spondylosis, rheumatoid arthritis cases are more in number. So we tend to compare even rheumatoid arthritis to Amavata. And there are other parts of India where they take the Amavata as also Vatarakta. And if you look at this Ama and Rheuma words, Rheuma is a Greek word meaning flux. So it was based upon the concept of this is the moist in nature with the morbid discharge of fluid in the affected joints. The word rheuma indirectly denotes the pratyatma guna of ama, that is drava, guru, snigdha, pichila, tantum, avipakvam, asamyuktam, daurgandhyam, abhishyandi, srotovarada, katu amla rasa and suktata. So that's how the word rheuma and the flux which reflects the guna of your ama. And a clinical presentation of ama of you see, so hands, feet, ankle, and hip and sacroiliac are involved. And nature of pain is like that of the scorpion bite, gastrointestinal appetite will see indigestion, loss of appetite, loose motions, constipation, gurgling, and flatulence, urinary symptoms, polyuria, cardiac environment, pericarditis, and constitutional fever and malaise. And this is an images progression of rheumatoid arthritis, early and middle and late. And even this post-viral arthritis. So this is one of the condition because of chikungunya. So that's also people have suffered from the years together. Post-viral arthritis, and that is gouty arthritis. Usually we tend to compare this gouty arthritis with vata rakta. And whether this rheumatoid arthritis is ama vata or vata rakta, yes, there are it ultimately depends on the, it's not the nomenclature of this disease. It is the ultimately depends on the symptoms presentation of the clientele. It varies. There are the cases where rheumatoid arthritis may be considered as vata rakta, and in other cases there are the cases we may consider rheumatoid arthritis ama vata. It depends on the presentation of the symptomatology by the clientele. And as generally the sandhivata or sandhigata is considered as an arthritis, and the lakshanas which are described for sandhigata vata in Ayurveda is sandhishura, that is joint pain, sandhishota, joint swelling, vata purna dhrutisparsha, feeling of touch and air filled bladder, sandhigram, restricted movement of joints, and akunchana, prasaranajanya, that is pain during extension and flexion of the joint. So these are the symptomatology be described under the heading of sandhigata vata. If you look at the Nidana and classical contemporary, there are many are mentioned in Ayurveda, but I look at the things in the different perspective. You know, Ahara, Nidra, and Brahmacharya is considered a Trayopastamba, three supporting pillars of life. The supporting, the direct pillars of life are Vata, Pitta, Kapha, and the supporting pillars for this Vata, Pitta, Kapha are the Ahara, Nidra, and Brahmacharya. And these three major factors are the major causative factor for this arthritis. How could you see ahara? Ahara means it's not the always we emphasize more on the highly nutritious diet. It's not that highly nutritious diet. That right diet, right means right in a sense of right in a sense of quantity, right in a sense of quality, right in a sense of the time. So the major aspects which because we in these because of in the modern era, so we are more having the adhyasana, anasana, and you know. Pramitasana, there are different asanas we usually follow. All these lead to the formation of ama, which gets circulated all over the body and gets seated in the joints, and that causes arthritis. And coming to the nidra is also one of the important factor because these days we sleep late and we get up late. So nidra is one of the important factor which so Ratri Jagarana, and it causes the Vata aggravation, and Vata aggravation directly affects the joints, functioning of the joints. And coming to the Brahmacharya is self-disciplined life, which more emphasizes on the simple way of living, that anything to be excess to be avoided, maybe excess vyayama and excess vyavaya, all things to be avoided, and it is a disciplined, self-disciplined life. So that is very important, and these directly are the causative factors for this arthritis. And if you look at this arthritis, osteo means an acronym, that is old age, and osteoporosis. S means sedentary lifestyle, sex and skin disease. T means trauma, endocrine abnormalities, obesity, and occupation. So these are the major causative factors for the osteoarthritis from the contemporary perspective. And this is one of the major earlier days. We could study in our biology books up to this level, that is human evolution. Now in the coming further generation will study this human evolution in this way. So that's how this obesity is one of the reasons. And another way of human evolution, this is how the human evolution started, and so because of continuous desktop jobs, gradually humans are being again going back to the first stage of the evolution. So these are the major contemporary causes for the osteoarthritis. And if you look, this is again one important, this I call this cell phone as a cell pain. So the cell is a functional and structural unit of life. So that's how we have taken this cell this cell as the way of life. So we don't find even a rickshaw puller. Everybody, we don't find anybody without a cell in their hands. That's how it has become. And continuous use for the COVID has made us to watch this COVID. People have become digital addicts. So if you look at watching this cell phone at this angle, that is almost 60 degrees angle, that means that it is equivalent to that 27 kg weight put on your neck. So if such is the case, how much being strain will be on your neck, and that causes arthritis of this particular neck vertebra. So that's how this cell phone is further increasing the osteoarthritis of the knee joints and the neck particularly. And if you look at this image in 1980 and 2013, how this fellow was so lean and his system was very heavy. And in 2013, down the line, maybe 2 decades, this fellow has become heavy and the displacement made him so sedentary that, and advancement has seen this has become so lean, so smart and lean, and whereas the individual becomes so heavy. And so this again one of the reasons for the osteoarthritis. So this anything which is prolonged, either may prolonged sitting or prolonged standing at one place, so that is definitely prolonged standing, definitely harmful. It affects different bodily systems. And these days, even the scientists have said that prolonged sitting and sedentary lifestyle is like smoking. So how a smoking causes a cancer, similarly, this sedentary life, prolonged sitting causes definitely lifestyle disease. That's how this is the strong association they found. And coming to the art, that is arthritis, art of the arthritis pain management, and the pain means that it pause and intervene naturally. So what is the heart and what are the aspects to be considered while managing these conditions? So naturally, Sandhi or Kapasthana physiologically, but as we say Sandhi Vata. So Vata in the place of Sandhi is definitely the presence of Vata in Sandhi is Agantuka dosha in Sandhi. So that's how Vata is Agantuka dosha in Kapasthana, that is Sandhi. So anything Vata Kshaya leads to Shleshma Vruddhi, that causes Sandhi Vishlesha. And Vata Vruddhi causes Shleshma Kshaya, that causes Sandhi Shedil. Usually we see the Sandhi Vishlesha in, and rheumatological conditions, whereas Sandhi Shedilya we see in degenerative conditions. And it is a Madhyam Roga Marga, that is, it is an Akritra Sadhya. And, as because of it is directly involved, Asti is directly involved. If you look at the Asiva Srota Drishti, you see Adya Asti, that is, bone is first, growth of the bone is first in osteoarthritis, and Sandhi Gata Vata and Asti Vidya. And Majjava Srotamula, we see Asti and Sandhi. And Vata Jananatma Jadi, Janu Veda and Janu. So all these aspects, Vata and Kapha and Astima Srota Drishti, Majjava Srotamula, and these all aspects has to be kept in mind while planning the management in arthritis. So if you look at this beautifully, Mala and Shula, the word Mala, how beautifully described in Ayurveda means, Mala means that impurities which afflicts the body with pain. So the Mala leading to the Shula, and the Mala are the substances which sticks to the various orifices inside the body, which are divergent forms and are in the process of being removed out of the body. Any Mala, so Mala even at any part, even for example, an adult, a 70 kg adult is supposed to perspire almost 800 ml to 1 liter in a day. So as the individual is breathing the entire AC environment, he could not perspire in 100 and 200 ml. So the perspiration gets diverted and it is being led to the polyuria of the individual, and at times it may not. So that obstruction causes the obstruction of the perspiration that leads to kind of a different bodily symptoms. And these are the major elimination systems of the body. So any obstruction, any disturbance in the normal, I've introduced this pill to these organs, that is K means skin, that is Pacha, K means kidneys, Vrukka, I means intestines, Andhra, lungs and liver. These are the major 5 organs in the body. So they take care of the eliminator systems of the body. So that is how these 5 are important. And most of the cases, I could see many doctors, particularly from Ayurveda fraternity, they diagnose it as a Sandhivata, and all they give maybe mostly they give Buglu and the tablets, and to the maximum, they give an oil for external application. But as the moment you say it is Vata Vyadhi, so Vata is being modulated. The best medicine to modulate the Vata is the Taila. So, but we are not giving any Snehana internal. So Snehana is, if you look at this quotation, Sneho Anilam Hanti Mrudu Karavati Deham Malanam Vini Hanti Sangam. You all know in the previous slide we learned that the Shula, Mala is the major reason for the Shula, and that has to be removed. Malanam Vini Hanti Sangam, that is only because of Sneha. So don't forget to give Sneha in different forms to internally also. Though Snehana is contraindicated in Amavata also, but even there is an exception that Eranda Thaila is highly praised in the Amavata also. And if you look at there's a contemporary management strategy and integrative management strategy. So objective should be to manage the pain primarily and maintain the mobility and minimize the disability. The major objectives of the management, integrative management. And the primarily it is a non-pharmacological management, and this is what in Ayurveda we say Nidana Parivarjana. Nidana Parivarjana means it should be dietary and lifestyle modification in yoga and physiotherapy. And the pharmacological management is one is symptom modifying therapeutics, structure modifying therapeutics, and disease modifying therapeutics. So usually we see in particular in Ayurveda, particularly in the area of orthopedics, so there are different four kinds of different practices. Either there are people who do only Ayurvedic diagnosis and they give Ayurvedic treatment. There are other style, there is a modern diagnosis and the modern treatment, and Ayurvedic diagnosis and the modern treatment, and modern diagnosis and modern treatment, particularly in the arthritis cases. So most of the people do more or less 1 or 2 or 3 and 4 at times in the 4 also as per the context. So, and as per Ayurveda, the major therapeutic triad, that therapeutic strategy is the threefold, that is Nidana Parivarjana. The first and foremost step is avoidance of positive factors. So avoidance of positive factor means you have to identify the way and to diagnose what is the Nidana, the positive factor which is being precipitating this particular condition. So most of the clientele comes to whoever comes to Ayurveda people, almost our 9 out of 10 will comes with the people who already are on steroids, who already having the painkiller for years together, they comes to us. So so being an Ayurvedic physician, our primary duty is to diagnose the positive factor instead of the diagnose the disease. So that's what, then only we'll ask the clientele to avoid the positive factor. Some Shamana. Yeah, doctor, I'm coming to the end. So it's already class. Yeah. So as I said, it is symptom modifying therapeutics. In the symptom modifying therapeutics, as I said, Patya, that is apatya has to be avoided. So that's what we'll diagnose. And Langana Pachana is also very, very important condition. In acute condition, prefer to give less and the simple drugs. So that is very important. And underlying conditions like hypertension, diabetes mellitus, hypothyroidism, etc. to be addressed. And usually in the acute cases, Varnabhupitras can be given BD and TDS. And Haldi, Shalaki and Pipali combination is highly useful. And Ashwagandha Churna given without, if there is a patient without fever, Kottam Chukadi Churna with Dhanyamla has to be applied. And Kajata Pinda Thailam, Balagulu, Chatailam, Kottam Chukadi, and Kashayas can begin Google Tiktam or Asana Rasmia Randati. So as per minute, you can do the quarterly Sweda. And as I said, Langanam, in Ayurveda, it's clearly mentioned is Langanam Paramaushadam. Langanam Paramosha. Langanam, not only it's a fasting, in Ayurveda perspective, Langanam is a broader in a sense. Even Panchakarma is also Shodhanam Shamanam Cheti Tatradvapiling. So that's how Langana is also a broader in sense. So even in this particular aspect of Langana is being considered as the contemporary version as an autophagy. It is cell recycling and remodeling. So this plays in when merges our metabolism to fasting and autophagy reload. So this is very, but these days, this particular fasting has become their fast food eat. So, and this particular aspect, autophagy, got a Nobel Prize in 2016. That's what the discovery is a mechanism for autophagy, that is self-eating. Autophagy is a vital process of degradation and recycling of cellular that supports the process of development cell differentiation. Its disruption is linked to disease of including cancer and neurodegenerative disease. So that's how this particular is highly raised. And apatya to be, as I mentioned in my practice, and in Ayurveda, diet has become a major role. That is apatya. That is, look at this image in this slide. That is patya sati gadartha sekimoshana nisham. Patya sati gadartha sekimoshana nisham. That means when diet is wrong, medicine is of no use. When diet is correct, medicine is of no need, is no use and no need. That is very important. So a clientele already is consuming the different, corticosteroids. So started from 2.5 mg, 5 mg, 7. Now he came to you almost weekly is taking twice, and still the problem is being prescribed. So where your duty is to evaluate and what exactly the is day-to-day diet. So those things has to be avoided. Usually in my practice, avoid all these things: milk and milk products, lemon and sour items, dry fruits and jaggery, soybean, salad and sprouts, coconut water, cool drinks, ice cream, besan and maida, urad dal, masoor dal, banana, guava, mango, all pulses except moong, and bread and sweet. These are the major one. These has to be avoided strictly. And in different medication, there are different kinds of medicines are mentioned in Angamarda Prashamana, that is Mahakashayavarga. They mentioned Angamarda Prashana that usually we can use in rheumatological musculoskeletal disorder. Due to short of time, I'm moving fast, and there are other group of drugs, that is Shula Prashamana. So usually Shula Prashamana used for antispasmodic, anticholic, and analgesic. In particular, these are the different drugs. And Vedana Stapana, it relieves pain sensation, particularly provide general Vedanam, Sammuyatam, Damyatya, Sharira. The useful condition where sensation is lost or damaged in various reasons. These drugs also relieve pain and bring body back to the normal. These are different Vedana Stapana Varga, that is the Shaimani. And this is Shotahara Dashema, relieves swelling and inflammation. And aggravated kapha, rakta, and with obstruct vayu, resulting accumulation of fluid in intestine, interstitial space, resulting shota. There we can use, usually Dashamula are the major one in the Shotara. So Dashamula we can highly. So out of my practice, consider based on the classical literature, contemporary evidences, and clinical experience. So I have introduced this Rujagna Dashaimani. That is the most potent top 10 herbs which are useful for analgesic effect. That is Rujagna Dashaimani, which is not mentioned in Shastra. But considering all these three, based on the classical literatures, contemporary evidence, and clinical experience, I introduced Ashwagandha, Ballataka, Eranda, Gugulu, Haridra, Nirgundi, Rasna, Rasona, Shellaki, and Shunki, and Ardraka. And moving further, as first we discussed the symptom modifying therapeutics. Now we are discussing structure modifying therapeutics. So if it is osteoarthritis, don't forget to use Gandha Thailam and Amrutadgul in gouty arthritis, Pradashangul in osteoarthritis of knee joints, and Kaisharogul psoriatic, Sivanadgul rheumatoid arthritis, Sunanadgul swelling. And we can use both Gugulu also, and with freshly prepared decoctions. So don't forget to use the Gugulu. Don't use the Gugulu as such. It has to definitely, if it could make it as a powder and mix it with either decoction or something, that is more highly recommended. So even for structure modifying, you can use the Janavasti also. And another one is a disease modifying therapeutics. Don't forget that use the Panchatikta Gugulu. This is highly essential irrespective of any kind of arthritis, maybe osteoarthritis, psoriatic arthritis, rheumatoid arthritis, any arthritis. So Panchatikta Gugulu is highly indicated because it shows its effects on Asti and Majja Vasrotos also. And other one, and don't forget you to use prescribe Brahmivati in autoimmune disorders. So that is very important. And Virechana Karma, usually I give Virechana Karma on weekly basis, that is Satyova Virechana Karma, with particularly Nimba Amrita and Thailam, which again it has an Gugulu in it, and it shows its effects on Asti and Medas Asti and Majja Vasrotos and Matra Vasti, Sandha Vayatailam and Natavadi Tailam, Kasha Vasti, and particularly Google Tita Kashayam. And ideal Gugulu preparation, most of our physicians who use Gugulu as such. But if you look at any Gugulu formulation in the Palasruti, Grutabande Nidapaye, that means every Gugulu has to be stored in Grutabanda. So that all the Gugulu formulation should be in soft and unctuous. But the Gugulu which we prescribe all are dry and that's a hard in nature. So considering prescribing those medicines and expect the result out of that, you don't find. So instead of that, but practically storing Gugulu in a Gutaband is also not possible in the market prescribed formulation. So we ask the patient to either to dip those Gugulu, whatever it may be, you prescribe in maybe suitable Kashaya or maybe in suitable Gruta, that is Gugulu Grutam or Nimbamruta Eranda, whatever Gandharavasa Erandam. So wherever it is suitable, there we can ask the client to make the dip in those things. And it should mix with specific liter. And in case readily available formulation, it should be treated with deep red admission, what I have mentioned. And as I mentioned, the Nimbamrita, the air and the Thailam, which I highly strongly recommend this. I use it is very widely, and I strongly recommend this. That most of the disease, Sevitam Pradhamati Prablam Samiram Sandhyasti Majjagatam Yam Kushtamati. So this is highly indicated in any disease of which is involving Sandhi and Asti and Majja. So this is very for oral and for Shamana purpose and for Virechana purpose and for Kashaya Vasti purpose also we can use this. And as I mentioned, if you look at just recollect in the first state, that is physiology of nociception, there is a last stage, there are 4 levels: transduction and transmission and perception, the 4th level. In particular in the chronic cases where they are suffering from the chronic pains, there I strongly recommend Shirodhara also, because the Shirodhara is normalizes, that is, as I mentioned, the pain perfect alternative or adjunctive in normalization of pain evoked in neural response in the chronic pain. So that's so Shirodhara is also highly indicated. And ultimately coming to the end, that the essence of Ayurveda is diet. I mentioned diet. Diet, as I've introduced this, I'm supposed to, I'm going to trademark this term. That is diet means, DI means dietary intervention. That is Ahara Patya Pati. E means exercise and activities of daily living. That is Vihara. T means treatment. So always diet comes to the first. That's how we avoid the positive factors and we give only specific diets. So and exercise, and this is how essence of Ayurveda. And the coming 12th October, that is World Arthritis Day. The theme of World Arthritis coming Arthritis Day is don't delay, connect today. So this is the theme. But I look at this today word, that is today means connect, today means to, D means daily, A means Ayurveda, and Y means yoga. So don't delay, connect today. Today means connect to daily Ayurveda and yoga. So that's what conclusive statement considering the upcoming World Arthritis Day on 12th October, considering that the theme. And thank you. That is Ayurvedo Rakshati Rakshitaha. That means he who protects Ayurveda shall in turn be protected by it. That means whosoever who follows the, whatever the modalities and lifestyle is being prescribed in Ayurveda, then they'll be protected by this. So thank you one and all. Thank you one and all. And now it's open for discussion.
Thank you so much, sir. Thank you so much for the presentation. It was really wonderful. We love your presentation and hope to see similar presentations in the future as well. Thank you so much, sir.
Thank you.
Now we have Dr. Raman Koirala, sir, consultant neuropsychiatrist, to express his vote of thanks in this event. He had done his MBBS, MD in psychiatry from PGI MER. I'd like to hand over this platform to Dr. Raman Koirala, sir. Sir, please proceed.
Yeah. Thank you, Dr. Pratima. And thank you, dear Professor Dr. Satya. And it was very, very, very good presentation. And especially me, I'm from a different fraternity, but for me also to look at it and to know so much about, and especially the implications of Shirodhara also in pain was very new knowledge for me also, because I've been brought in this family of Ayurveda, where my father was a very great academician. And even on this platform, I would like to thank all the academicians in Ayurveda, and I would like even the young graduates of Nepal to at least promote academics in Nepal. And I would like to thank all the esteemed professors and my seniors and my colleagues who had done this webinar. And I would like to thank all the organizers who conducted webinar in name of my father and in his memory. And it was a great opportunity for so many young doctors also to learned so many knowledge from senior professors. And my father always used to love academics and always used to promote academics. And it was great that all the young doctors and the senior doctors also initiated this webinar in name of my father. And I still remember the last slide that Professor Satya had presented, that he who protects Ayurveda and Ayurveda in turn protects him. And I'd seen my father from initial days, and even for me also, whenever I used to get ill, used to suffer from any sickness, my father always used to give me some Ayurveda medications. And I would like to tell some story about when I was in India, in Chandigarh, and I had suffered from very severe food allergic reaction, and it was type 4 hypersensitivity reaction, and I had been suffering from it for almost 1 year, and I used to take levocetirizine quite often. Then my father sent some herbs. He sent it from Nepal itself and packaged and sent to me. I consumed it, and within, I think, 21 days or 25 days, I could see so much radical change within me, and there was no any allergic reaction. So I have very deep respect and for what my father had done and for Ayurveda itself. And I had seen my father also being protected by Ayurveda, as he used to protect Ayurveda and used to promote Ayurveda throughout, not just in Nepal or India, but throughout the world. And it was such a pleasure that during this time when all the young doctors had initiated the webinar in his memory, doctors from Sri Lanka, India, Bangladesh, and Nepal could join and listen to all these lectures. And it is a great honor for my whole family that we could in turn see some academic work being done in name of my father. Usually we all pay some kind of condolences, but this was a very good and a very heartfelt condolence for us also, because we could see he was himself an academician, and in his name the academic programs were done, which was a great heartfelt condolence for him. And at last, I would like to tell what my father was asked during, I think, 1996 or 1998 at possibly Sweden or somewhere, in an international conference by a professor. He asked, what is the best form of healing? And my father had said, the best form of healing is self-love. And I would like to tell all the esteemed professors out here and my seniors, my colleagues, thank you so much. And I would also like my brother, Rishabh Kurala, who is, I think, currently has joined the webinar, and even he would also like to speak some words in name of my father and as a vote of thanks to the organizers. Thank you.
Thank you so much, Dr. Raman sir, for your soulful words. Do you have Rishabh brother here, available here?
Yes, I am here.
Would you like to
Thank you so much.
say something? Please continue.
Yeah. I would like to thank you all for all the love you have showered, all the love from all the we are always continuing to for the growth of Ayurveda, and we hope to do that. I don't say that my father is he was the father of all being for Ayurveda in Nepal. So I'd like to thank you all, and from my deep thank you.
Thank you, Rishabh brother, for your words. Now we are at the end of this webinar series. So I'd like to thank our speakers, Dr. Satya Dornala sir from India, and Dr. Raman sir, similarly Rishabh brother. And I'd also like to extend our hearty thanks to our co-organizers, Felix Zain from Bangladesh, ADF, Ayush Darpan Foundation from India, and Vivida Private Limited from Sri Lanka. Thank you so much, co-organizers, and all the dear participants for joining us today. Stay connected with us. And I'd also like to express hearty thanks to all the participants joining us to live stream. Thank you so much.